AM 1450, FM 99.3 KNSI. Hi, this is Bob Hughes, and welcome again to Your Health, produced in conjunction with CentraCare. Today's guest is Pediatrician Dr. Jill Amsberry, and in the next 25 minutes, we will talk about water safety, keeping your kids safe this summer, sun exposure, and making sure those kids use those helmets when they're out there bicycling. Dr. Jill, it's great to see you again.
Yeah, thanks for having me.
Well, summertime just around the corner, right? You've got a 4-year-old, you've got an 8-year-old. Are your kids about ready?
No, they're very ready.
No doubt. Yep. When it comes to being a mom as opposed to being a doctor, you know, sometimes it's real easy to delineate those two roles, right? But when you're raising kids and summertime rolls around, oh my gosh, how do you not worry? Right?
Yeah, it's challenging.
What are some of the more important things that we need to keep in mind when it comes to summertime and kids and safety? Would putting on a good dose of peanut butter for sunscreen be the one?
Peanut butter is not what we'd recommend.
Probably
but yes, definitely protecting your skin and your child's skin from the sun. Mm-hmm.
Pretty darn important. When we talk about SPF, is that sun protection factor, right?
Right. Yeah. Yep. And many people think that they need to get the highest SPF, and that's, you know, that's going to be the thing that protects their kid the most. But what we know is that really anything between SPF of 15 and SPF of 50 is adequate. Anything over 50, we haven't found to be more beneficial. The most important thing is, regardless of the SPF, that you're applying it every couple hours. Right.
And I was only literally joking. I promise peanut butter is not a good sun protection factor.
No, but it's interesting that you say that, because a lot of people think that sunscreen is the only thing that they can use to protect their kid from the sun. And actually, sunscreen is an additional factor, but we recommend a lot of other things that can help protect yourself and your child from the sun.
You mean like hats and clothing?
Right, exactly. Yes. And, you know, just the time of day that you go out.
You know, it's interesting to me. You look around the world, right, and you see people that are just exposed to sun. I think of the folks in Australia, for example, right? When it comes to skin cancers, that sort of thing, and I know that you're not a skin cancer doctor, but that doesn't mean you can't worry about it.
Right. I'm a prevention doctor,
there
right?
You go.
Yeah.
What do those folks do? Is that where the whole sun protection factor, the whole sunscreen thing came from?
Yeah, well, we certainly know that the rise of skin cancer in Australia is significant, but we're also starting to see that here in the United States as well. And so that is, we get a lot of our data from Australia, but we have our own data here to remind us what we need to do.
Well, I shouldn't tell you this, but I used to have a nickname, was Brown Bob Short Pants, because I used to live in tanning beds.
Yeah.
My wife and I were both sun people.
Yeah.
And then all of a sudden, it must have been, probably 15 years ago, we just stopped doing all of that. It's not a good thing, is it?
No, it's really not. And like I said, you know, more and more we're seeing the rates of skin cancer increasing even in this country. But a lot of people, like I said, think sunscreen's the only way. There are other important things that you can do, like, for example, wearing long shirts, long pants, things with a thicker weave.
Well, and we were talking about Australia earlier. I know that people down there there are companies down there that have started marketing sun clothing that is specifically breathable and all of that. I mean, fishermen wear, and women wear that same type of clothing. They always have big floppy hats on. Right. Now you're starting to see hoodies, you know, that you can pull up in the summertime. It's a nice lightweight clothing that lets air in and out.
Right, exactly. And we have that available here too. The difficulty is it's expensive so far. And so not all of our families can afford that.
Right. True enough. I had a piece of skin cancer taken off my ear earlier this year. So I'll be wearing a floppy hat from now on.
That's right. Yeah.
Usually no hat whatsoever, but you know, you can only fool around with Mother Nature for so long.
Right. And the other thing is just trying to avoid those really high sun hours. So especially 10 to 2, if possible, you know, going out before 10, particularly after 4, when the sun's not right up above. So the dermatologists like to say, if you can see your shadow and the shadow is longer or shorter than you, then you're okay.
You're okay, but it's when it's disappeared you have a problem.
Correct.
Good enough.
Yeah.
The sun would be at its azimuth, I believe, the highest point in the sky. Right. Now, what about our eyes and eye protection if we're out in the sun?
Yeah, that's right. So you want to make sure that you're using 99% UV protected sunglasses. Mm-hmm. And we recommend that you do that all the time when you're outside.
So you've seen the wraparound sunglasses, right? Even if sun gets in from the side, right? That can be a bad thing.
Absolutely. Yep, absolutely.
Now, what about kids? And that's specifically what we're talking about here, sun exposure in children. Is there some type of a precursor that you would be able to identify? Oh my gosh, you have red hair, for example. Your skin is going to be much more affected by the sun's rays as opposed to the next person who may have a little more pigment. Yeah,
good question. So certainly, the majority of people who have pale skin know that they're going to be sensitive to the sun. But what most people don't realize is that all skin types and skin colors are sensitive to the sun. So everybody should be following the same recommendations.
I always used to think that I love having just a little color in my skin, and that makes me look healthier.
Yeah.
The problem is when your skin tans, it's been damaged, and it's the skin's reaction to that sun damage.
Exactly. Right. No color is better.
Why do you think doctors are as pale as they are? Because you're smart. That and the fact that you're working all the time.
That's right? I guess. Yeah.
Well, and I'm going to go with the intelligence too. Go to any doctor's office, go to any hospital, and you don't see a doc that's got a good tan.
Right.
You guys know something.
My boys are out in their floppy hats and their sunglasses and their SPF clothing and their UVA, UVB protected sunscreen.
Good for you, Mom. Nice job. Nice job. So let's kind of change topics here when it comes to summer safety. Rollerblades or inline skates, I guess. Roller skates. Kids are on bicycles. When I was a child growing up, you never wore a helmet at all. But now, oh my gosh, it is the way to go, is it not?
It is absolutely the way to go, yes.
Now, the advent of this use of helmets, what's the reason? I mean, everybody understands you fall, you bonk your head, you got a nice, gaping wound on the forehead or the back of your head but what about that whole shock absorption thing? Because that's really what the helmet's all about, right?
That's right. So we know that there are hundreds of thousands of head injuries from bicycles alone, with hundreds, sometimes in certain years, 600 to 800 actual child deaths from head injuries due to bicycle riding. And so that helmet protects you from that impact. Not 100%, but it's around 90% protective against serious brain injuries.
And if I understand it correctly, it's the design of the helmet that takes the impact, that force, and just distributes it all throughout the helmet, right?
Yep, that's right. Yep.
Have you ever had your kids at all, or perhaps have you ever treated any kids that have had some head injuries from bicycles?
Absolutely. And I always tell my families in the clinic, it's easier for us to fix a broken bone, but it's really hard to fix a broken brain. Right. So those kids that I've seen, they have pretty significant injuries that often are lifelong.
That's pretty serious stuff to think about, folks. Put those kids in bike helmets. They're not that expensive, are they?
That's right.
And put a price on your child's brain. AM 1450, FM 99.3, KNSI. You are listening to Your Health. Dr. Jill Amsberry, pediatrician at CentraCare, is our guest. A quick break. We'll be right back. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. Our guest, pediatrician Dr. Jill Amsberry. We are talking about all things summer fun. We're going to try not to suck the fun out of summer here. We were talking, Dr. Amsberry, about kids and bicycle helmets, right? I couldn't tell you the first thing to look for. Never purchased a bicycle helmet in my life. I have 7 grandchildren. They should all have their bike helmets. I know they do. But if I wanted to go out and buy one, I wouldn't have the first idea what to look for.
Right.
Can you help me?
Yeah. So often if you go to local bicycle stores, they can help you, with that determination. Most helmets that are sold right now are safe to use. So depending on price, the most important thing is that you find a helmet that you feel like, 1, you can afford, that you'll buy, 2, that fits your child, and 3, that your child will wear.
Sure. So what do I look for? I mean, how do I know how they're supposed to fit and all that stuff?
Right. So the helmet should fit snugly, and the chin strap should should fit not tight, but fairly snugly, so that when the helmet is on the head, it shouldn't wiggle around.
Flop around at all. Okay.
The helmet also should sit kind of where a visor would be if you were wearing a baseball cap. So it shouldn't be up. It should sit almost level to the ground.
Gotcha. What about width between the actual helmet and your skull? Should you be able to get a finger up in there or no?
There isn't specific guidelines for width, just making sure that it's not wiggly.
Okay.
But there are guidelines for width between the chin strap and your chin. So 2 fingers between the chin strap and your chin.
All right. Now, you said the most important thing is buying the helmet that your kids are going to wear.
That's right.
I suppose this involves leading by example, doesn't it?
That's right. Yeah, it's so important that parents are also wearing their helmets. And what most people don't realize is that the majority of bicycle accidents actually happen right near your home. And so sometimes people will decide to wear helmets when they're out going on long rides, but forget to wear them right in their own driveway where most of the accidents happen.
You know, this is a great time, and I know that local communities, local police departments will have bike rodeos, that kind of stuff. Mom and Dad, get your kids to these bike rodeos. They're free, right?
Absolutely.
And you can learn the proper ways, the hand signals, all that stuff, the right way to be safe when you're riding your bicycle. I will tell you that as I'm motoring down the road, if I see a bunch of kids on a bike, doesn't it just scare you? Because you don't really know where they're going, what they're going to do.
Yes, absolutely. They're unpredictable and not always thinking about where the cars are.
But I will say I've been very fortunate. Nobody has, zipped out right in front of me. So obviously some parents are doing their job right.
That's right.
You like to see that. Good work. There are some other things that parents can do to make sure that their kids are nice and safe. And again, it is all about leading by example. Should we switch from the bicycle to perhaps being on the water?
Absolutely.
Okay, if you're going to wear your helmet, Mom and Dad, you darn well better have that life jacket on.
That's right.
Right? If you have a child in the boat with you, it is the law. The children must wear life jackets.
Yep, absolutely. So in the state of Minnesota, any children 10 and younger who are in a watercraft should be wearing life jackets all the time.
And it doesn't matter if the boat is moored or not. There are some stipulations there and ages, that sort of thing. But like you just said, that particular age group, those kids have to have their life jacket on. And listen, there are so many different kinds of life jackets that are out there right now. You've got the old-fashioned vest kind, right? You've got the ones that automatically inflate when they hit the water. That's what I would get for the kids, the automatic inflatable, only because you don't even know you got them on.
Yeah, so actually the automatic inflatables aren't what we would recommend for the
children?
kids. Right.
Listen, we have an expert in the studio. And why is that? I thought it would be perfect, like no thought, right?
Yeah, most of those you actually have to tug in order for them to inflate.
Okay.
And so for the kids...
Oh, yeah, you wouldn't want them to do that.
Correct. They're not going to be able to do that. They'll be panicked.
Okay.
And so we want those life jackets to be on and ready all the time.
So why would you be thrown from a boat? Why would you have to have that life jacket on? Imagine it's a catastrophic event. That is about the only time that you're going to jump from the boat into the water unless you're swimming around. You do not have time, Mom or Dad, to find that life jacket and put it on. Imagine if it was a son or daughter and you're all thrown in the water. Well, I wanted to get that life jacket to Billy, but I didn't.
That's right. Yeah. And as we know, kids are unpredictable. So any parent knows that. And we never know when they might decide to just go take a swim.
That's true. Well said, Mom. I'd forgotten about that. No, we would never do that. Of course we would. What is it about water and kids? Kids love the water, whether it's the toilet bowl or the lake.
They do. And actually, drowning injuries or drowning deaths, I should say, are the number 2 cause of death in children less than 4 after birth defects.
No kidding.
Yeah.
And it's just... I only turned away for a minute.
That's right. And toddlers actually can drown in just 2 inches of water. Yeah. So sometimes it's just, water in a bucket.
Again, summertime is a great time for moms, dads, kids. You're out there doing all sorts of fun stuff. But there are some things that we need to keep in mind. I don't want this to be, Debbie Downer or anything like that. But we do have to think about these kinds of things.
Yeah, and the goal is that we have fun this summer and we don't have to deal with injuries.
You could be having the greatest time of your life, but if you hadn't thought about some of these things and a tragedy happens, right? We don't even need to finish that sentence. AM 1450, FM 99.3, KNSI. Summertime fun. Oh, we're not done talking about the water. Dr. Jill Amsberry, pediatrician with CentraCare, our special guest. One more break. We'll be right back. KNSI. You're listening to Your Health. AM 1450, FM 99.3, KNSI. Your Health is on the air. Dr. Jill Amsberry, pediatrician with CentraCare, our special guest. We're talking about summertime safety, and we have made the transition into water safety. I don't know about you, Dr. Jill, but one of my favorite things to do with my kids when they were younger and I was younger is we'd go to the hotel. There'd be a pool there, right?
Right.
And the kids love to play in the water. We thought, oh, we'll just put these little arm floaty things on and they'll be just fine. Au contraire. Arm floaties are not the way to go. What do you do with your kids when you go out to the pool?
Yeah, so we spend time at the pool. We also have a boat and spend time at the lake, just like many of the Minnesota residents. And number one, when we're at a local pool, if it's a place where we feel like we can be there and be watching,
right.
For our younger child, we're always within arm's reach. And so we never
go. He's
go.
only 4 or she is only 4?
He is 4.
He is 4 years old, okay.
He's 4, yep. And with our 8-year-old, we make sure that someone's always watching. So it's easy as adults to just start talking, get into conversation. People look at their phones, and then no one's watching. And the problem is that drowning is silent.
Yeah.
When we're in the boat, our kids are always in life jackets.
Right.
And we've found life jackets along the way that seem to be good fits for the kids.
Well, that's important. How do we know that they fit correctly? I know that there are some life jackets for kids that have a strap that goes down under their legs. Do you have to go that route for little kids?
It depends on the age. So interestingly, the Coast Guard does not recommend that kids less than 18 pounds go on use a life jack or are on a watercraft.
Okay.
And the main reason for that is because the life jackets that are so those infant life jackets, those for the less than 18 pounders, aren't guaranteed to keep your child afloat or safe. If you have the opportunity to practice in a pool with a life jacket and you can tell from that practice that it will be safe, then it's probably okay to use.
Sounds like moms and dads need to be a little responsible when it comes to water safety in their kids, right?
Absolutely. As the kids get older, then they don't necessarily need those straps anymore. And my recommendation is similar to the helmets, and that is that use one that's Coast Guard approved and that's appropriate for weight.
Sure.
And if you're doing that and they're wearing it, that's the most important thing.
Right. Teenage Mutant Ninja Turtles or something. Make it cool.
That's right. Yeah.
So they're going to want to put that thing on. What happens if a child falls into the water? I mean, worst case scenario, what do we do?
Yeah, that's a challenging one because the majority of people, when they're doing water saving, they're usually thinking about adults. And in those situations, they don't recommend that anyone else jump in. Because the adults can be the adult can become a victim too. That's right. Exactly. For kids, it's a lot more challenging. So depending on the age of the kid, still, if they're older, if you can just reach or send out a life preserver of some kind for them to grab onto, that would be what was that would be what would be recommended. Gotcha. But for the younger kids, someone often will have to go in there. That's when it's nice when the adults also have their life jackets on, so they're not working on trying to keep themselves afloat. You consider yourself to be a good swimmer? I wouldn't consider myself to be the greatest swimmer. No. Right. Who is? Right? Who is? Swimming especially lessons. Panicking. Take swimming lessons, correct? That's right. Yep, that's right. Are you aware? Have you ever heard of the 50-50-50 rule? Tell me about that. I don't know. All right. A good swimmer, when the water temperature is 50 degrees, a good swimmer has a 50% chance of swimming 50 yards. That's a good swimmer. Right. 50-degree water, a 50% chance of swimming 50 yards. After that, you're done. Right. Yeah. And we see that, throughout the summer here in Minnesota, we see adults dying of drowning off boats. And people often wonder, well, how did that happen? Right. And that's exactly why. Well, again, the only reason that you're going to be thrown out of the boat is because of a catastrophic event. You hit something, somebody hits you or whatever. You don't have time to grab your life preserver, then your life vest, your personal flotation device. At that point, you're trying to save your life. That's right. Or somebody else's for sure. How about the importance of planning, right? You sit down, hey, mom, dad, we're going to go on this big vacation. You come up with your checklist, right? Well, don't forget to think about safety things. That's right.
Planning equals a great time. That is for darn sure. Do you know of a particular publication where moms and dads could go to get more tips on water safety?
The Coast Guard has some good information about life preservers. Okay. Red Cross has some good information about water safety and saving other individuals from drowning. And then healthychildren.org, which is put out by the American Academy of Pediatrics, has lots of information on childhood drowning.
Healthychildren.org.
That's right.
All right. Now, I'm going to tell you this. The local St. Cloud area family YMCA is in the midst of swimming lessons. St. Cloud Parks and Rec through community education is a great place to go for swimming lessons. How old were you when you had your first swimming lessons?
I was pretty young.
Yeah, me too.
Yeah, for sure in that kind of 4 or 5 range.
Yeah, I don't consider myself to be a good swimmer at all. When I was younger, it didn't bother me. I'd hop out in the water, but anymore, no way.
Yeah, in our family, we've decided that all sports are optional except for swimming lessons.
Ah, very good. Very good. If you're a Minnesotan, you should be having swimming lessons. There is no doubt. Right. Dr. Jill Amsberry, good to see you again. And if folks would like to maybe have you be their child's doctor, are you accepting new patients?
I am not.
You're not.
My practice is closed.
You're full.
Right
well,
now.
There's a good reason for that, right?
Oh, thanks.
Well, thank you for stopping by again.
Thanks for having me.
Dr. Jill Amsberry, pediatrician with CentraCare, and you have been listening to Your Health on KNSI. Have a great, safe summer.